Medicare. Jamie is also a member of Kidney Stories Toastmasters. She joined us recently. Let's welcome Jamie Imhof.
Guys, hi, can everybody hear me okay?
Yes, we can.
Okay, excellent. All right, so you covered, I am going to share a lot of information with you. We're going to do this like a little fireside chat. I do consider myself quite an expert on it. I'll give you a little background. In order for me to get a kidney transplant, because you guys, they don't just give kidney transplants to end stage alcoholics, you have to earn them. So in order to earn them, one of the first criteria that I had to do was become a kidney patient without any help. So my social worker at the hospital at Hopkins said, you have to go on disability yourself. You have to go on Medicare. You have to do that. You are not allowed a lawyer and you're not allowed any assistance. Good luck. As soon as you get this, we'll talk to you. Otherwise, you can pass away on dialysis. And I had to do it quick. So as safety net, you only have within the year. So I took it upon myself in that month frame to pretty much master these systems on my own. And then from there, I wanted to make sure that no other patient was left hanging. So now I took a deep dive into all of this, where I consider myself very well versed, even beyond disability lawyers, because I sat on their lectures before, that I actually assist most liver patients on these cases individually. So I can't exactly speak on individual cases unless you'd like to communicate with me afterward, that we can go over your case, but we're going to get an overall rundown. So we're going to cover SSDI first in the first up to 10 minutes, and then we're going to cover Medicare and end stage renal Medicare. Those are two different types that are available. So let's go over SSDI real quick. So if you have a pen and paper, because I thought it would be better just to talk about it since it's so much information, I didn't want to be switching from all of these slides, is that SSDI and SSI are two different things, okay? SSI is known as Social Supplemental Insurance Assistance. It's available to anybody that's an American citizen when they don't have income. That's it, okay? It's got a max of $900 a month, so that it's solely income-based, okay? So that is in your sense, and that's also the programs that come along with it, such as food stamps, transportation assistance, also come with that. It's also known as your Medicaid as well. And all that, again, the income restrictions are based upon the state. So some states have very low maximums. Some states have higher maximums. Now, all that has to be filed through the state. When you go over to SSDI, which is known as Social Security Disability Insurance, that was a fund that has been paid into as you work. So this isn't, a lot of people get confused. They say, I don't want help. I feel bad for asking for help. You're not asking for help. You actually paid into this. I'll give you a prime example. When your car breaks down, what do? You call your car insurance because you have car insurance and they help you out. When you break down, you call your SSDI that you paid in through your FICA taxes, Federal Income Contributions Act. It's one of the 4 taxes that are found when you pay. You have federal and then state, and then your FICA taxes, which is also your retirement fund. So it's the same thing, all right? It's your FICA, so it's SSDI and retirement. So you want to go ahead and pull from that. Now, in order to qualify for this before the age of 65, being retirement, you have to have a certain amount of work credits, okay? Work credits are earned by simply that, working, okay? So you work, you can get it for a year, they fall per quarter, and you have a bare minimum of literally $1,700 that you have to pay in taxes per quarter that you get 1 work credit. So you don't even need to work that much. But what they want to see is that you've been working consistently over the years. If you try to apply for SSDI, you need usually about 40 work credits. So you can kind of think about how many years you're going to have to accumulate with that. And they usually want 20 of those work credits to be in the last 10 years up until your disability began. And I want to say began because here's the way SSDI and Medicare work. It's not based upon your filing date. It's based upon your determination date. You can take this back as far as it can be medically proven, and it will be backdated. Everything of mine was backdated. I had the maximum of everything that we can go over later. So just because you filed in December, let's say you filed even after transplant, and you're like, wait a minute, I need some extra assistance now. Everything goes back to the moment that you first were, even before dialysis, that you found some kind of qualification, which we'll cover here in a second, in the actual rules. So again, don't hesitate to think like, okay, well, it began now. No, it goes way back. So going back to that, with that thing, so there's two aspects of filing for SSDI. Is first, like we said, the work credit verification, which we said we need like about 40 credits. We need 20 of them to be preferably in the last 10 years up until your disability began. Okay, not being out of work. So if you were disabled and been out of work for like 3 years, they're going to put that 10 years before that to where the disability is. You can take this pretty far back. Then from there, your income is factored in a little bit on your reward, but it's mostly just based on the work credit. So let's say, okay, I got all that. I paid my FICA tax. Now it's the determination of the disability. So you go and you file. It's a little bit confusing because if you want to take a look, if you go and type in, all this is available online, and you look for what's called the SSI Blue Book of Jerry T. urinary conditions. So SSI 6.0 moving onward. All right. Those are all of your renal/kidney conditions. You look through the criteria, you'll be surprised what you can qualify. So of course you begin being able to qualify the moment you go on dialysis, if your dialysis is expected to continue for a 12-month period and beyond. Anything other than CRRT dialysis, you're going to qualify, period. All right. So your disability, your SSI doesn't begin at end stage kidney. It can actually begin sooner, because if you look at the conditions under 6.02, there's a condition that says, okay, you have CKD. As Kathy Lovely mentioned, all of those symptoms that she mentioned earlier are a separate condition. Fluid overload, that's a condition. Wasting away, anorexia, that's a condition. So this isn't based upon your diagnosis, it's based upon your conditions, which you impair for you for the ability to work. All right. So under that CKD, you need two things. All right. So you just need to have a GFR of 20 below only 2 times in a 90-day period. You're done, you qualify. And then condition B, so that's condition A. And then condition B is what we mentioned, like I said, a fluid overload condition. Have you been hospitalized? It was 3 times within a year with 30-day apart. You've been hospitalized for conditioning. That's a condition. So you might be surprised. So even though you're sitting, like, let's say at 18, a GFR of 18, but you have all of these symptoms, however, you're not on dialysis, as long as, like, okay, you're overloading fluid, you're getting ascites, you're getting all of that, you can qualify for SSDI. You just got to file. Okay. So make sure to think about that. So let's go over the filing really quick. This is a recommendation I give. Okay. I'm going to take a break for a minute. So when you file for SSDI, set up first an online portal. Okay. If you strictly file online, they have 30 days to assign you an agent. Okay. Currently, the wait time to get your SSDI claim is over 8 months at this point. All right. It used to be 6 months. Mayor O'Malley took over last December. In April this year, he announced that they're so backlogged from COVID and everything. They're up to 8 months now for processing. So if you're filing online and you got 30 days for someone to even sign an agent, all of this just adds up. So you want to file online first under go to ssa.gov, start that. And then you want to call your local field office and get assigned an agent. When you call the local field office, they have to provide you an agent that call, actually. And that will be the agent who works with you and starts processing your claim. There goes 30 days out of it. And you want to develop a good relationship with that agent. When I talked to my agent, for example, he felt so bad for me that he was like, I'm going to expedite everything because we got it under a special case, under a there's a whole bunch of it. But I established a good relationship of mine that I was able to get things done right away. So definitely recommend doing that. Let's see here. Just take a minute here. And yeah, so up to 6 to 8 months, you want to continually to keep checking and keep asking them where you are on the processing of that. Now, let's just say you get processed sooner, okay? And they just get it through in a month or two. You do have what's called a 6-month period of long-term disability determination. So you won't receive your first SSDI payment till the 6th month. And those 6 months, you get no back pay for it whatsoever. So it begins on a 6th month, but then again, that's backdated to the determination date, not filing date. Let's say you file in December of this year, but then they look back and say, wow, you were disabled for 2 years ago. Your disability will begin 6 months after the determination date, and you'll get a back pay settlement. Plus, moving forward, your monthly award, which is all determined by how many work credits you have, along with a little bit of income that you had in the past. On top of this, guys, you can still work on SSDI. You can make up to, as of right now, $1,555 tax included per month and work on SSDI. Because remember, it's an insurance fund. It's not necessarily based on income. So just keep that in mind. Okay? I think those are a lot of things to cover for SSDI. You can feel free to ask questions. Let's turn to Medicare. All right. So just to let you guys know, Medicare, there's 2 types of Medicare. So there's Medicare based upon SSDI filing, which you get if you go on SSDI and you don't qualify for end-stage renal Medicare, which is, of course, end-stage we know is a GFR 15 below, then you also do qualify still for Medicare after 24 months of SSDI payments. So there's another way. So let's just say you're hovering at 18 for, I don't know, 5-6 years and stuff. You may actually still be able to receive Medicare after those 2 years and be qualified and be able to insure yourself throughout that. So just keep that in mind that begins then. But now we're going to switch over to kidney end-stage renal Medicare. When you're an end-stage renal failure, you're property of the government. I love to say that, okay? Because the government's required to pay for your dialysis. So whereas the government may not want you to get on SSDI, they want Medicare-wise, they want you transplanted, they want you off of dialysis because it costs them a lot less than keeping you on that $90,000 worth of dialysis every year versus getting you transplanted. They're going to do everything they can to get you to transplant Medicare. Anything you save $1 on Medicare budget makes every politician happy. So you have to keep that in mind. So end-stage renal Medicare, okay, the dialysis coverage begins on the 4th month of when you begin dialysis. So you have the 3 months. However, if you choose to participate in home dialysis training, it can begin that month, actually. You don't have to do home dialysis. Just do it. Just to participate in the training, just so you can get your Medicare right away. All right. And then on top of that, if you also, there are some leniencies too, depending on if you're completing all those dialysis sessions right away in that 1st month to get on to the Medicare. Let's cover Medicare quickly, what it is. So you have Part A, which is hospitalization. All right. So that's, just think of it like this. You go inpatient, you sign in and go into a hospital. That's Part A. Everything's covered under Part A. And then Part B is outpatient services. So it means that if you're not being admitted, everything is covered under that. And then you have Part D, which is, of course, your drug plans. And then, of course, if you want Advantage plans, they can fall under, Part C, the Medigap, all of that and everything. We can talk about that. But just break it down. You have Part A, Part B, and Part D. Your dialysis and all of its services are in a bundle packages that's set up by CMS under Part B. So that should include pretty much everything. It includes like testing, the actual services. I'm going to cover some things it doesn't cover, and most of the medications. Kathy brought up a very good point of why nutrition is very important, because under the CMS bottled package, it covers medications that are in a pill form or a liquid form, but not a powdered form. There goes your potassium binders. So you're going to need those under a Part D pad, not your phosphorus binders, because those are pill form, but your powder forms are going to go under your Part D plan and everything. So this is going to be a big one to keep a note of. All right. So these are the services you might want. All of this is provided under, if you go to Medicare, you can literally type in endstage.medicare.gov and read through the 50 long page packet. But I want to cover a little bit about the blends and Advantage plans too. I'm not neither pro nor con Advantage plan. I had an Advantage plan and then I have traditional. Here's the main differences. Advantage plans will cover some services that are not covered by traditional. One of the big services for dialysis patients is Advantage plans will actually cover transportation sometimes. Traditional Part B does not cover any transportation services. I was in a wheelchair. I required a van to take me to dialysis. I had to use Medicaid services actually at the time to do that. All right. So unfortunately, because at that point I was still waiting for my Medicare to kick in. But it's something to keep in mind if you want to look at the advantages. The Medicare plans still have to follow. They still can't charge more than the premium of Part B, which is $174 a month. They have more options for drug coverage. However, when it comes to transplant afterwards, Medicare plans tend to be very limited on the types of doctors you can see afterward for individualized specialty treatment. For example, like after transplant, if you need a dermatologist, a lot of them don't take advantage plans. If you need, anything of that, a lot of let's see, my gynecologist was not covered under that, and I'm facing some stuff with that. And then the other major advantage of an advantage plan, of course, is dental insurance for afterwards. So these are things to keep in mind on whether you wanted to stay on the traditional versus the advantage plan. It's just all about the pros and cons. I would list out all the doctors you need to see, all the medications you require, and what you foresee about going back to work afterward. So let's speak on work insurance really quick. So pretty much this way, depending on your work insurance, if you're still sitting on work insurance, they may or may not, you have to call them, they may or not cover. Some of them will supersede to Medicare, knowing that you're going to get that Medicare, and then they'll fall back and cover the 20%. Because remember, Part B is covering the 80%, and then you have that 20%, copay in a sense. So they may cover the 20%, or it might be that they actually still take the bulk of it, and then Medicare will be your secondary, and then covers the other 20%. Again, I can't speak individually on that. You have to call whoever your plan is for a work insurance and see which one. But in the end, it's really helpful to have Medicare. You don't have to pick it, but it's very helpful to have it while on dialysis and after dialysis too, because of course, once you're transplanted, you get 3 years of kidney Medicare. Kidney Medicare is great, guys. You don't even have to be on dialysis or anything or end stage. Once the minute you get a kidney transplant at a Medicare facility in the United States, you get kidney Medicare for 3 years. All right, so keep that in mind. Under that Part B plan come all your immunosuppression drugs. All right, so your work coverage, they may charge 3 times the amount for your drugs. Then the cheapest amount to pay for those immunosuppression drugs is Medicare Part B, whether you like it or not. So you may want to defer to that afterwards. So it's just, these are a lot of decisions you have to make on an individual basis too. And then as we wrap up here before questions, there are some other programs too. Medicare Part D has an extra help program. If you have very low income, they will actually pay for your drug coverage plan. And on top of it, there's something called the QMB Medicare, which is also for low income if you have Medicaid, and that will pay for your premiums plus your 20% copay as well. And you can apply for that. Again, if you're not working, you can try that. So I used to be on all of this. You know how much I paid for everything? Nothing. All right. So there's a lot of resources because like I told you, the government wants you to get a transplant because otherwise they're paying a lot more for your dialysis than transplant. The last thing I'm going to cover is I know you've all heard about this wonderful supposed, where you're going to get our drugs paid for your life with just passed for 2023. Yeah, there's a lot of stipulations with that one. First of all, you have to be end stage renal failure to get it. Okay. You have to complete the 36 months. You have to stay on kidney Medicare for 3 years. Okay. And then once you lose that, you can turn on that plan if you have 0 other insurance. You can't have any other insurance. All right. So it's really like a contingency plan if you have absolutely nothing. On top of that, you have to pay its premium, which is $101 right now this year. And then you still got to pay for the drugs. Now, I kid you not, I even costed out my drugs. It was cheaper to buy my meds when I was on basic tacrolimus off of Cost Plus than it was to pay the premium and the copay on that. So you got to factor in all of these things, considering in the future about how you want to progress. I know that was a lot of information. So who's got questions for me?
Wow, that is indeed a lot of information, Jamie.
I have it all memorized.
We can see that. And the fact that you were able to go through, navigate so much and finally pay only $0, that's just amazing personally to me. I have been on immunosuppression for 26 years now. And when I started my immunosuppression, it was back in India, where we had to pay everything from our own pocket. So, Jamie, you're muted, but I have Cynthia raised her hand.
Jamie, are you saying that when you get the last topic you talked about and talking about the meds, I know you pay the 100 into premium, but then you said that you still had to pay for the meds. I
Yeah.
understood it that once you get that plan, that the meds were covered because that's why you paid the premium, and you only had to pay, well, you had to pay for your other meds that weren't transplant.
No, so the extra, so we're talking about what's called Part B ID coverage. What it's allowing you
Right.
to have is to keep the Part B. But so, for example, my Part B, if I pick up my tacrolimus, I still have a copay of $250. All right, but based upon my income. And so the difference is that I still get to keep all of that going. I just have to pay $110 on top of a premium per month plus the coverage for the drugs. So that other part of that, for example, that's only my copay. And then the other that part is covered by the ID plan. You see what I'm saying? So you still have to cover your premium per month, and then your copay has to be paid with that too. But then you don't have to pay the full amount that your drugs would cover at market value.
I see. Okay.
Yeah.
I see. Because I worked
Yeah.
with that. I worked with that plan. Okay. Thank you.
Okay.
Yeah.
Thank you, Jimmy. There is one more question from the chat. How do you know when to go from disability to end stage or kidney Medicare?
Simply 15. So actually, they'll automatically switch over, to be honest with you. So that way you have everything covered. And oh, there's an important thing I wanted to tell you guys too, is that if, let's just say you're doing a living donor and you're before all that, your Medicare begins 2 months before your living donor transplant. Yeah, all of it is covered. Like even all the testing, any of that, just file it and get it going. So they have a 2-month grace period for transplant set up for anything done before that for living donors.
Okay.
One other thing too, guys, a little hint, and then I'll get another question, is guys, I'm going to give you a thing. With the Advantage plans, there's a reason not to go on Advantage plans after transplant and stay with traditional, is that if you cannot afford immunosuppressant drugs with your copay, is that many of the drugs have a patient assistance program like I'm on now, that you will not qualify if you're on Advantage plan, but you will qualify under traditional. I'm currently on one right now. I pay $0 for my $800 a month in Barcis through a patient assistance program because I chose to go back on traditional Medicare. So I'd rather take the 20% of outpatient services because I have very few appointments versus the 800, like the huge copay I have with a part with an Advantage plan. So you got to consider all of these things when you're picking Advantage plans. All right, next question.
Yeah, I think this is more than a question. A lot of great information. Do you have any of this in writing so that it can be a handout?
I want to put it all up in
people?
writing. Yeah, and like, yep, I'll get it in writing. I'll get a PDF with even more stuff. Yes, for sure. Give me a
Okay.
week to do it. Yeah.
So yeah, if you can, I guess it will be too early to just get a PDF within this
Yeah.
by the time this session ends. So, but when you get a PDF, I can send it to all the registrants so that they will have an idea.
So, Shobha, I just looked at the chat. She's absolutely right. So, Miss Jones, yes, she just confirmed what I said. The same thing is that plan that I was speaking about that we all thought so highly of, which again is a worst case scenario. Frankly, I'm going to be real honest with you. If you're taking more than 5 milligrams of tacrolimus, you save money. Anything below that, and mycophenolate, your drugs are cheaper off a cost plus. They're absolutely right. So it all depends on how much milligrams of the tacrol you're taking, and that it makes a difference. Every milligram of tacrol is more and more and more expensive, you know. So unfortunately, it doesn't matter so much with CellCept or, you know. But then again, also if you're taking Beltacept infusions, you may want the ID plan later on in life. So it all, again, you got to balance it out.
So there is one more question. Will kidney Medicare pay for transplant meds after 3 years of coverage?
Yeah. So no. So that's what kidney Medicare is. So as soon as you go on kidney Medicare, so you have end stage renal failure Medicare, and then the minute you're transplanted, it switches from ESRD to kidney Medicare. And 3 years of your immunosuppressant. Now listen, your drugs under Part B, you got to make sure they're billed right. So Part B covers anything with immunosuppression. That's your prednisone and any of the drugs, CellCept, Beltacept, and tacrolimus, cyclosporine, all, you know, everolimus, all of that. All the other drugs fall under your Part D plan if you have traditional, or your Advantage plan for the Part D drugs. So is that clarified? So remember, only immunosuppression and goes under Part B. Everything else, Part D. You can still qualify for Medicare after 3 years if you have any lingering conditions. They'll determine you. So they just have to see. You may actually have other conditions that fall under something else, like SSDI, that'll go backdated to that. So they'll do the whole redetermination case and see what's available. But hopefully, theoretically, you're doing fabulous, and you got to find something else. And that is a hard time to switch. Yeah.
Thank you, Jamie. That was such a wonderful session in lightning speed also that we learned
Oh, yeah,
everything.
I've got 20 minutes.
No, that was really good. And a wealth of information. So if you don't mind, please give us a handout. We would all love to know how to navigate these things. Thanks a lot. With that, we will move on to our next session, which will be by Dr. Powell. Dr. Powell completed his fellowship and residency